I mean, every mother matters, right? But we know that right now, systemically, that Black and brown women are dying at high rates. And there's reasons behind it, and it's so multifaceted. So when you have a community that is experiencing high disparities in maternal health, we need to highlight it. We need to ring the alarm so we can completely change it. You have women that are afraid to have babies because they might die, right? And that is not acceptable, not in the United States, not anywhere in the world. So we have Black Maternal Health Week to say, hey, this community needs additional support, needs additional research, needs additional community resources. We need to go all out to ensure that every Black mother is safe and protected throughout her pregnancy, postpartum, and beyond. So, you know, with a community experiencing more issues in the rest of the United States, we're seeing that we're improving maternal health for everyone else but our Black women. That's why this is needed.
We're expecting this is going to be our first child. Okay. And it's a lot of stuff that I haven't experienced, like the question about the prejudiced doctors, if we encounter that was educational information that we just didn't know before. This is the dope event.
I've noticed that there's a lot more resources. There's a lot more education that has been centered around Black maternal health, which is amazing, which is great. So it's getting a lot of people more educated on what to do, what they're experiencing, being more vocal about it. So it's a lot more advocacy that's been going on for Black maternal health.
Black maternal health matters primarily because Black lives matter. So we can always start there. And we also understand intrinsically that what's good for Black women is good for everyone. And so with Black women being the most marginalized community in America, and always has been, historically speaking, it only makes sense to start from that area and do something about it. Just as one of the panelists was saying that, you know, we're seeing these maternal mortality rates and we're seeing these maternal outcomes improve. However, not for Black women. We're still seeing maternal health care deserts. We're still seeing racism. We're still seeing autonomy being stripped across the nation for Black mothers. And so it really matters to raise awareness for this and to be addressing it from all these different angles. I'm a birth doula myself, and so I'm fortunate to be touching the full spectrum of from prenatal, birth, and postpartum. But there's so many other avenues like advocacy, research. There's so much infant loss that needs to be addressed. And so the fact that we're all raising awareness, it's a good thing.
Because as providers, we have to remind ourselves that we have to care for each and every person equitably, like they're my mother. So it doesn't matter what race you are, what background you're from, you have to care for everyone equitably. And what we're seeing in the healthcare system is that people have biases that they don't even know about. They're implicit biases. And they're treating patients differently. So in their mind, they might be like, oh, I care for all of my patients, but you have that implicit bias and you're treating your Black and brown patients possibly differently. And now we're seeing that in outcomes. Now we're seeing that, even though in maternal health, the morbidity mortality rate is improving, everything but for Black women. Right. So there's something there. There's some, unfortunately, uncovered biases, maybe some racism that is occurring. We know that it's a multifaceted issue. That's not the only reason, but it's a multifaceted issue. And we have to bring light to that issue, and we need to educate everyone.
So this event matters because joy and justice for Black people in general, especially Black women, it's meant to uplift us in these type of times. We remember back in the day where Coretta Scott King was going through so much when justice was not the best in her era, and we feel like we are there again. More importantly, we're there because the Black maternal health rate has declined more than double in the past year. And so what we want to do is make sure everyone has an outlet. Everyone has a wellness place or support. Everyone has things in place in a community so that we can further thrive through these hard times, because this too shall pass.
Black maternal health matters because Black women are more than 2 to 3 times likely to die from pregnancy-related causes. It's important that we educate the community, that we educate Black women and those that are supporting them of the resources and the supports that are available to help them as they journey into motherhood.